just a disorder about inattentiveness, impulsivity, hyperactivity. What's going on here? So this is what 30 plus years later, I've been treating ADD, adolescent psychiatrist. What's going on? It's a disorder about self-regulation. And what do I mean by that? This disorder, it hits the frontal lobe, this part of your brain, the frontal lobe. Specifically, the prefrontal lobe. What does that mean? The lobe in front of the frontal lobe. And what does that lobe do? That lobe allows you to plan in the future and think about the consequences of your behavior in the future. So if you eat candy every day, someone with ADHD will be like, oh, I want candy. It'll make me feel good. It tastes good. They know the consequences immediately. I feel good. It tastes good. But they're not factoring 10, 20, 30 years down the road. It causes diabetes, weight gain, obesity, insulin resistance, atherosclerosis, hypertension, coronary artery disease. No. So it's a disorder about behavioral inhibition. And what are the consequences of this? It's about 8% of the population. Everyone, this rumor that it's overdiagnosed and we're a pill-pushing component, that's wrong. It's underdiagnosed, especially in adults, because by the time they get to adulthood, no one worries about attention deficit disorder. What are the consequences of this disorder? It's not just about inattention, and it's not just about impulsivity, hyperactivity. What are some of the consequences for these people? Well, for one, this disorder is a constellation of things. Do you know that people with attention deficit disorder have sleep disorders? They have trouble sleeping and they always wake up tired. They have a much higher incidence of sleep apnea, meaning where they stop breathing at night. So that could ruin your day. They have 20% increase incidence of depression, 30% increase in anxiety, because they're always worried about never getting anything done, and they never get anything done. And as a group, people with attention deficit disorder have no insight. They're externally focused. So they don't even know all this is going on. They don't know they're worried about sounds and touches on their skin, the tags on their clothes, that sweater's uncomfortable, but they're not internally focused. So their ability for self-assessment is very low. So they don't know these things are wrong. So if we take that a step further, do you know the rates of obesity are dramatically higher in this population? That relates, because they see food, they eat it. They don't think about the consequences of their food decision. And they usually pick sugar and white flour or complex carbohydrates that are not healthy, that increase atherosclerosis, hypertension, coronary artery disease, plaques on your coronary arteries get smaller, you get a clot, you get a heart attack. And they're more prone to strokes. They're also more prone to cavities. One, because they're always eating sugar. Two, because they don't brush their teeth. Now, this rate of obesity is much higher in attention deficit disorder because that behavioral inhibition, that self-regulation is missing. Makes sense. With this obesity comes these higher rates of diabetes, blood pressure, the sleep problem, but also all this leads to a 7 to 9 year loss in lifespan in people with attention deficit disorder. Also the mortality at every year, people with attention deficit have 2 or 3-fold the rate of death than the normal population. There's more to that. It's not just that they eat too much, they don't sleep. They are much more prone to poisoning, lacerations, broken bones, horrible accidents, reckless driving, speeding, risk-taking accidents, especially before the age 10. A lot of them die from dangerous behaviors because they're risk takers. They don't have that behavioral inhibition. I had one kid who was at a construction site and there were all these cinder blocks with rebar sticking up and he was walking in between The rebar on the cinder blocks, he fell, went right through him. He lived, but, who had the guts to do that? He was, 2 stories in the air walking on cinder block with rebar coming out. Not to mention when they buy the dirt bikes or motocross, someone with attention deficit with a motorcycle has a dramatically higher rate of dying. Their rates of suicide are higher. They're much more impulsive in terms of suicide. Also, there's more to it. In terms of relationships, they're much more prone to be the victims of bullying, and they're much more prone to be the bulliers themselves. They're much more prone to cause domestic violence. They're much more prone to get a divorce or break up. They're much more prone to go from job to job to job. They're much more prone to make money and lose a lot of money because the consequences aren't there. They're risk takers. They make it and lose it. They're much more prone to wind up in jail. They're much more prone to be smokers and have all the secondary pulmonary complications, chronic obstructive pulmonary disease, emphysema, lung cancer, dramatically higher. Let's talk about smoking. Smoking puts nicotine into the body. The nicotine increases dopamine, the prefrontal cortex. Maybe that's why they smoke, because they could focus better. Nicotine is a stimulant. Do they drink more coffee? You better believe they do, because caffeine blocks adenosine and it increases dopamine in the prefrontal cortex. What else is going on with these patients? Same reason they eat, it increases dopamine in the prefrontal cortex. Do they drink? Yes, they compulsively drink and use drugs dramatically more, because in this state where the prefrontal lobe has less dopamine and to a lesser extent less norepinephrine and less GABA, they feel empty. So do they wind up using a drug to feel full? Yeah. And do they use a food to feel stimulated or to give them something they're missing? They're always empty. They're always bored. So they're either looking to eat, do a drug, bite their nails, fiddle. That's what attention deficit disorder people do. They wind up using the marijuana. The caffeine helps them focus. The nicotine helps them focus. But the alcohol does not help them focus. It sort of feeds that emptiness within inside them. But they get all the consequences of alcohol, just as anyone else abuses alcohol. And they wind up in jail more often. They wind up the victims of homicide more often. They wind up the victims of suicide more often. There are some things, these are all studies that I recently read. Because of all this, their self-esteem is way down. They feel that they're failures in everything they do, when that's not the case. And that upsets me to no end, because I treat adolescents and I see them taking a mortgage test or a financial plan or exam, insurance exam, fail. And they have the sense of low self-esteem. And I'm like, stop it. You are a capable person. It's just these tests are not your thing. What can they do? They're inventors. They're entrepreneurs. They're paramedics, cops, firemen, stockbrokers, entertainers, people in the military, actors. These are all people with attention deficit disorder. They're very capable. There's no correlation with ADD and lower IQ. Zero. None. So let's just stop there. And their verbal skills and ability to communicate is very high, very capable at that, because they learn not to read. So the mind compensates by better verbal skills. And also something is better in people with attention deficit disorder. They're more creative. They're idea people. They come up with all the ideas. They're risk takers and move forward. And something else happens with attention deficit disorder. Due to the hyperactivity, the need to fiddle and move when they're young, their motor skills develop sooner and better. So they become better athletes. But overall, on the long-term picture with people with attention deficit disorder, they're more sedentary and they're less apt to be physically fit, and they're more apt to be out of shape overweight, binge eat. In women, the rate of bulimia nervosa is much higher, and also the rate of fibromyalgia in women is much higher. Interesting combo. The only drug out there for binge eating is a drug for attention deficit disorder, Vyvanse, less dexamphetamine. And why is that? Because binge eating increases dopamine in the prefrontal cortex here, and that's what Vyvanse does, increases dopamine in the prefrontal cortex. There's medicines you can use. Wellbutrin, bupropion, increases dopamine and norepinephrine in this area. Now remember, serotonin decreases and downregulates and makes the body less sensitive to dopamine and norepinephrine and serotonin in the prefrontal cortex. So that actually hurts people with attention deficit disorders. You don't give them SSRIs. The one drug you can give is bupropion. You can also use another drug that increases norepinephrine called atomoxetine. And now there's a valoxazine. Atomoxetine is called Strattera. Atomoxetine is Strattera. And then the Quellbri is valoxazine. Another one that increases norepinephrine in the prefrontal cortex. But the serotonin drugs, Prozac, Paxil, Zoloft, Luvox, Alexa, Lexapro, Effexor, Pristiq, do not help. They actually hurt. And then you say, well, if this person's anxious, doctor, are you going to, you have to give them something. Give them a benzodiazepine. Yes, you're giving them a stimulant or an amphetamine, but you can also give, because they have low levels of GABA too in the prefrontal cortex, which helps with anxiety. You can mix a benzodiazepine with a stimulant or amphetamine in people who have anxiety with attention deficit disorder. Oh, Dr. Agresti, I thought benzodiazepines decrease working memory, and that's a problem with attention deficit disorder. So are you going to mix the two? Well, yeah, and I'll tell you why. Because the anxiety component undermines working memory more than the side effect of the benzodiazepine decreasing working memory. This leads me on to the topic of marijuana, which decreases working memory, which people with attention deficit, because they feel empty, they feel bored, they don't have that dopamine, they don't have the norepinephrine in the prefrontal cortex, they don't have the GABA, so they feel empty, bored, they're constantly, I guess, empty. I can't explain it because I do therapy with them, because it's really important with this population to do therapy. Yes, I use stimulants. Do I use sleep medicines? You better believe I do, because they don't sleep. They don't sleep. They're a mess the next day. And they have all these sleep problems. So I'm giving a long-acting amphetamine or stimulant, like either Concerta or Vyvanse, methylphenidate, or lisdexamphetamine in the morning. I can sometimes use benzodiazepines like Klonopin low dose or trazodone for sleep. I may potentiate the action of that stimulant or amphetamine with bupropion, because that increases norepinephrine. So I do try and treat the sleep disorders. I do try and treat the anxiety, and I do try and focus on attention deficit disorder, and I try and keep them away from marijuana. That one never works. And as for caffeine helps them. Nicotine helps them. So what am I supposed to say? Yeah, don't smoke tobacco, maybe, but that nicotine you're taking does help you focus. And it helps with anxiety, believe it or not. And that caffeine helps you focus. There's a fine line between taking too much and getting anxious, but it can be used therapeutically. Now, this population, very prone to divorce, very prone to overeating, very prone to criminal issues, very prone to anxiety, depression. So I have them in therapy. They have low self-esteem. Their ability to self-assess is low. So I work with them in therapy to help in all these areas, to help them work out their marriage so that they're not engaged in inappropriate behaviors, yelling, screaming, hitting. No good. I don't judge them. I try and help them. It's the bulk of my practice. I sympathize with these people with attention deficit disorder. I make sure they get their teeth fixed. I'm a freakazoid about getting your teeth fixed, keeping away from sugar, watching their diet, watching their weight. They all wind up overweight. I'm extremely careful. I make sure they don't quit their job. They're always quitting their job. I'm like, fine, it's one thing to move when you're moving up, but just to randomly, impulsively quit or mouth off to your boss, your spouse, or to your children, it's not going to work. I have to work on self-regulation, behavioral inhibition, and impulse control. It's key features because it's what leads to their early death. It leads to the higher mortality every year because they do such dangerous things physically, interpersonally, socially, with their family. They wind up in jail more often. It's not right. This illness has to be treated. It's undertreated in the adult population. And I really think a good place to start this is a shout out to family practice doctors who probably treat more of it than any. I hope family practice doctors watch this and see that they need to treat and they need to do therapy in terms of self-regulation behaviors with eating, drugs, nicotine, caffeine, relationships, interpersonal skills, job skills, family skills. And you say, well, if this population is a much higher incidence of substance abuse. Do you know it's protective? Giving them some treatment, like an amphetamine or stimulant for attention deficit disorder, decreases substance abuse. The long-term effect of amphetamines and stimulants is not there. There's considered to be minimal risks, virtually none, where the risk is no treatment. No treatment predisposes these individuals with attention deficit disorder to substance abuse. So I get these mothers, I don't want to get them addicted. I don't want to use drugs. You're all pill pushers. That's the wrong message. That hurts these kids. That just sentences them to a higher risk of drug use, higher risk of inappropriate behaviors, a higher risk of getting involved in criminal activities, a higher risk of binge eating, a higher risk of dangerous behaviors, weight gain, diabetes, coronary artery disease, traumatic events, alcoholism, domestic violence. These are all factors in non-treatment of attention deficit disorder. So my patients out there, please do not beat yourself up, get treatment. I do therapy, weekly therapy, and when I do have them come in with the medicine once a month, because you have to be seen once a month to get amphetamines or stimulants, I make sure I educate them. Are you taking care of yourself? You watching what you eat? Are you exercising? Because they don't. Are you keeping away from flour and sugar and fast food and crap like that? Here's another one. They're impulsive sexually and wind up with all these sexually transmitted diseases. That's another reason for their increased morbidity and mortality. So meaning death per year and decreased lifespan. They don't use protection. They always seem to wind up having these relationships, these one-night stands. It's dangerous to live like that. And I educate my young patients on that. And I'm really strict about it. I'm like, I don't like the smoking. Nicotine may be helpful, and I have to say it chokes me to say it, but I'm like, at least vape or use lozenges or gum. Don't smoke tobacco. It's the worst. Coffee, I'm okay with. Limit it. 400 milligrams a day. After that, you cannot take more than 400 milligrams of caffeine a day. You'll get too anxious. And do I give them something for sleep? You better believe I do. Do we treat the attention deficit disorder? Yes, you do, for everything I've said. If you want to get me going, you give me an adolescent who has untreated attention deficit disorder and is beating himself up and thinks he's a failure or loser in life. That upsets me to no end, because he could be treated and be very successful. Remember, these people are creative. They're the idea people. They're the risk takers. You need that. You need people like that in every group, because they're the first ones to get things done, to try a new thing, to come up with a new idea. They're very verbal. They're very talkative. They're very capable in terms of interaction. That's kind of basically what I have to say on everything right there. There's going to be a whole series of blogs coming at my blog, dragresti.com. And this is a shout out now to people in the United Kingdom, Canada, and Australia. That's the bulk of who watches me. And people in Chicago, Miami, and West Palm. That's about it. Thank you. And my book's for sale on Amazon.com. It's Tales from the Couch, Mark Agresti, MD. Thank you, and bye, everyone.